There's lots of heroes in this room, and Jay being one of the heroes. Anyone who's recovered from an eating disorder is a hero, and we applaud you. So I'm here to tell you about the FREED Act. What we need from members of Congress and staff in the room is we need you to take a look at the federal response to Eliminate Eating Disorders Act, which Congressman Deutsch is championing for us this session. And we're going to do everything possible to pass it, right? So there's three components to this bill: research, education and prevention, and treatment. The reason why we need the FREED Act has clearly been outlined in the presenter's remarks to you today. So there's parity has not worked the way we hoped it would work, the way it was intended to work. The ACA has potential, but in the meantime, we also need the FREED Act, because what the FREED Act will do is provide more access to care. It actually says that if an insurance plan covers physical illness, they must also cover eating disorders. And then specifically we say, the bill says that it must do so according to widely accepted, research-based or clinically based best practices, and that's the APA guidelines that a few of you have referred to today. So that's really critical, because if there's sort of universal criteria, then we're all operating, from the same, playing by the same drum, so to speak. And currently that's not happening at all. It's really willy-nilly what kind of, what the insurance companies will approve and what they won't, and we don't even know what their criteria are most of the time. So this bill will really eliminate that, because we'll be using widely accepted criteria. So that's a really key point to the FREED Act. Then in terms of education and prevention, one of the common concerns and complaints we hear about is that when somebody's finally ready, somebody who's suffering is finally ready to take that step and go talk to someone, go talk to their primary care doc or some other medical professional about it and get support, is they don't respond appropriately. Where primary care docs will say something crazy like, wow, you look great. I wish all my clients were as thin as you. Most people are obese or something ridiculous like that. And what they don't realize is that has now set that person's recovery back, year, 2, 3 years. Because we know from the research, early identification, early intervention, good outcomes, better outcomes. So currently, medical professionals do not get that kind of training. They get maybe 20 minutes in med school. So the FREED Act addresses that. It also addresses programs to train educators in the school system. So teachers, counselors, coaches would have a sense of what are eating disorders and how do I detect them, and then how do I refer folks who I think might be suffering. So that's a really important component. The research section, I'm just pulling out some of the pieces. I'm not telling you all everything that's in here. In the research section, it's important for us to better understand how to treat eating disorders. There are some good treatments these days, but we need more research on what treatment works with what kind of population, what's most efficacious, so we need more research on that. We need to understand the etiology a bit better. We need to provide training opportunities for new researchers. We need to get more talent into the pipeline. We also need a sense of what's the economic burden of eating disorders. And so there's a piece in the bill asking CDC to really take a look at that and look at the mortality rates associated with eating disorders. So we urge you, if you're a staff or a member of Congress, we urge you to sign on to this bill. You have time actually to be an original co-sponsor. And if you're interested in doing so, you can, there's contact information. You can actually call or email Joel Richards, and let's do a shout out. He's Joel is the staff member in Congressman Cogan's office, and he's been working really hard on these efforts. So thank you very much. And we have about 2 minutes. So we have time for questions. If anybody has questions for anyone on the panel and the congressman. Yes.